Do not forget to leave us a comment to respond to, and be sure to click the subscribe button. Human or animal food consists of a group of main elements: proteins, fats, carbohydrates, vitamins and minerals, in addition to water. Disturbances in the representation of these nutrients in the body are considered problems that affect human and animal health and productivity, and are usually caused by a lack of certain nutrients or by the interplay of some elements with each other, which leads to a loss of their nutritional value in addition to its negative impact on the rest of the nutrients in the body. Iodine is one of the minerals that are rare in nature, but it is an important vital element for humans and animals, as it is involved in the formation of thyroid hormones, thyroxine, responsible for metabolic processes in the body. Among the most important symptoms of iodine deficiency is an enlarged thyroid gland, or what is called a gutter, keloid, or cervical commodity, as the gland swells under the skin in the front of the neck below the throat and can be seen or felt around the trachea, or seeing carotid pulses in the neck as a result of pressure on the gland. This disease has been known in China since the 3rd millennium BC. As for the Egyptians, they knew it about 1500 BC and treated it surgically. The cause of the disease was known in 1811 AD as a result of a lack of iodine, and the element was used as a treatment in 1831 CE by the French scientist Boussingault. The use of iodine to prevent thyroid disease in the U.S. state of Michigan for the first time in 1924 AD. What is meant by iodine? Iodine is an element of mineral salts, and the body needs it in small quantities, but it is necessary for human life and physical and mental development, and the adult human body contains an amount ranging between 10 to 30 milligrams of iodine, 2/3 of this amount in the thyroid gland, which uses iodine to produce the hormone thyroxine needed for functions. There are many vital substances in the human body, where another part of the iodine is found in the muscles, and trace amounts in the liver, ovaries and adrenal glands. What are the functions and benefits of iodine? Iodine is essential in the production of the thyroxine hormone secreted by the thyroid gland, as it is necessary for the safety of the thyroid gland and preventing its enlargement. Iodine regulates the growth process and the function of nerves and muscles, the process of energy transfer and the acceleration of the metabolism process, as it helps metabolism burning excess fat. Iodine plays an essential role in the development of the fetus, so it is necessary for physical and mental growth and development. Iodine contributes to the mechanism of oxidation of cells at the liver level in the production of red blood cells. Iodine is necessary to maintain the connective tissue in the body, which creates tendons and ligaments and joins tissues together. Iodine contributes to the activation of the heart muscle, and helps the body to release toxic wastes that are generated from protein substances absorbed by the walls of the intestine, and it goes with the blood and leads to hardening of the arteries, as it protects against high blood pressure and affects the respiratory system. Iodine contributes to strengthening weak nails and prevents hair loss. Scientists believe that iodine plays an important role in regulating the cholesterol manufacturing process. Iodine plays an important role in helping the body fight disease, as it helps reduce nervous tension and insomnia. Iodine is used in the manufacture of some types of medicines, especially those used to get rid of the effects of radiation. Iodine is the most effective ingredient in purifying fresh water. What are the symptoms of iodine deficiency or increase? Women are 6 times more likely to develop symptoms of iodine than men, because they need iodine during pregnancy and lactation, and their iodine deficiency leads to a deficiency in the fetus, which causes major problems for both the mother and child. The main symptoms of iodine deficiency: an enlarged thyroid gland. Iodine deficiency leads to an increase in the activity of the thyroid gland that is located near the throat in the neck, which leads to its enlargement, and there are many such cases in the inhabitants of mountainous regions, because of the limited iodine in their food and coastal residents, so fresh water contains a small amount of iodine. However, sea salt is not considered rich in iodine as some believe, because the main ingredient crystallized is sodium chloride, while iodine is in the precipitating liquids that are excluded. Symptoms of goiter are many, including lethargy, fatigue, frustration, memory loss, constipation, nervousness, hair loss, dry skin and other small signs that ring the alarm bells and draw attention to the thyroid gland. The brain development in the fetus is related to the presence of iodine in the diet of the pregnant mother, as well as the matter for the infant, and the lack of iodine during pregnancy may cause the death of the fetus or its exposure to major problems at birth. As for the infant, his neurological development becomes insufficient, and thus is subject to mental retardation, and the symptoms accompanying this may appear very late. Children who suffer from iodine deficiency do not necessarily show symptoms that are easy to diagnose, delaying alternative therapy and increasing the severity of risks. Some research has proven that children in the age group of 10 to 12 years, born of mothers suffering a lack of iodine during pregnancy, their cognitive and motor abilities are less than normal, which confirms that the lack of iodine and its decrease during fetal development represents a risk and its consequences are negative in the long run. Doctors do not advise increasing the iodine dose during pregnancy as long as it is available to the mother naturally. If there is a deficiency of iodine after childbirth, an amount of 160 to 200 micrograms per day is usually prescribed to the nursing mother. Increasing iodine intake more than the daily allowable limit can cause some symptoms, such as a feeling of metallic taste, ulcers in the mouth, swelling of the salivary gland, rash, diarrhea and vomiting, as well as fatigue of the thyroid gland. What are the sources of iodine? Iodine is found in most marine fish, tuna, herring, sardines, salmon, in addition to shellfish, octopus, algae, and seaweed. Do not forget to leave us a comment to respond to and be sure to click the subscribe button.